Anatomy, anatomy, anatomy. Hi, I'm Dr. Ibrahim Moghimi. I'm the founder of International Academy of Aesthetic Medicine and welcome you to my fourth case presentation in aesthetic medicine. I said anatomy. I'm so excited to say that anatomy is the backbone of our aesthetic medicine knowledge. If you don't know about the anatomy, you don't know about the aesthetic medicine procedure. I'm sure you are agree with me that anatomy is the backbone of medical knowledge in different specialties. But in the field of aesthetic procedures, as a young medical course in the world, anatomical knowledge of the face is the first step to learn medical procedures that you will use in your future activities in your office. Actually, a lot of complications that arise in the field of aesthetic medicine, and I am showing you in this video series, are because of the lack of knowledge or poor knowledge about the anatomy. Some of our co-workers do not pay close attention to the depth of an artery or vein or a nerve fiber under the skin. And this may make some problem for them when they are injecting fillers or they are doing mesotherapy or they are working with thread lifts or injecting fat or are doing some clinical surgeries in their office. I try to talk about the complications based off an academic concept, and my academic concept is based on an anatomical knowledge. This is my friend that will help me to show you some complications that you may encounter in your job, and I will be with him or her in my future activities. In this video, I want to show you how a tiny obstructed artery in the nose may result in a very terrible condition, a necrosis of the nose with a very terrible deformity that you may not be able to repair it naturally for the rest of the life of this patient. I invite you to watch the second part of this video. As we talked about the anatomic branches of the arteries in the face, actually the lower face, in the third case presentation that was about the ischemic events in the lower lip, we saw that it's a very interesting branch that comes up from the border of the mandible to the nose. This is called facial artery. Facial artery may have some branches to the upper lip that you will see. This is facial artery that comes from the lower border of the mandible to the nose, and then it has a branch that goes to the upper lip, another branch goes to the lower lip, and there's one critical branch that may go to the nose. This branch is very, very tiny, and it has many different variations. One of its important branch is angular artery. Angular artery, you should remember from now on, because in most cases, obstructions of angular artery is our first diagnosis suspicion for the ischemic events in the nose. There are two hypotheses for the obstruction of arteries in the nose. In one hypothesis, we assume that if you inject some fillers in nasolabial area, and if you make a tiny puncture in the facial artery, there is two possible ways. The first possible risk is that the filler may go into the artery and obstruct the whole artery completely. Here you will see the paling of the face and a huge pain. But the second possibility is that entrance of the filler in this artery is not completely obstruction. It is a partial obstruction. It is stopped here, and then after 2 or 3 or 5 days, the thrombosis of the filler will goes upper and upper, little by little. Remember, there is no obstruction because the whole arteries canal was not completely obstructed, and the particle of the filler was not so big to obstruct the whole artery internal wall. So it starts to go upper and upper, and when it go upper to the nose area, just in the transmission of the arteries, just when the arteries are divided into different tiny branches on the nose, a tiny filler that was moved from here to here will obstruct one of the tiny arteries in the nose. This may happen after 3, 4, or 5 days, or may happen after 2 weeks. So the patient comes to you after 1 or 2 weeks and says, "Hi doctor, I have something here. My skin is going darker and I have some pain. I have injected filler 2 weeks ago, and you injected it and it was perfect. There was nothing dangerous to my face, but this morning I woke up and saw that there is a little bruising here and I am worried about it. What is this?" So I will talk about it. The pathophysiology of the obstruction of the tiny arterioles as the late complication of the filler injection. We talked about the early complication and late complication. Early complication maybe the complete obstructions of the arteries just when we are injecting fillers in the nasolabial fold, in the globular fold, and or in our lips. But late complication may arise when some tiny particles of the fillers move in the arteries and go to the bifurcation areas when the arteries are divided to different branches. There they will obstruct and the ischemic process will begin. So, how the ischemic process begins and what are the signs and symptoms? The filler was injected here and it went into the artery, the fascial artery, and then moved to the upper part and went to the upper part and reached to the nose area where there are a lot of branches, tiny branches. And you will see in the next pictures the involvement of this part. I like to show you a case here. The nasolabial injection was done 1 week before, and then as you see in the upper half of the nasolabial fold here, as you see, upper half, if we divide the nasolabial fold in one line, the upper half of the nasolabial fold is filled with filler, and I see that it is over correction. In other words, the filler was injected much more than it was needed before. I see some bruising here, and bruising shows that it was a puncture at the site of the injection. In other words, the needle was entered the facial artery under the nasolabial fold. And as you will see in the next pictures, this injected filler was entered in the artery, but it was not stopped. It tried to move to the upper part of the nasolabial fold artery called facial artery. As you see in this anatomy, when the patient was at this stage, the doctor prescribed some antibiotics and did not inject hyalase or hyaluronidase. He decided to wait and see, because he also prescribed some antibiotics, and we wanted to see that if this bruising and swollen area will subside. But unfortunately, after 1 week, another event happened, and Our coworker sent another picture and said that the nose was also involved. So how he found that the nose was involved? First, there was a red part in the nasal area. As you see, the nasal area was red, but one of the hallmark of the ischemic events that we may see is pustular eruptions with yellowish pus in them. They may be very small or big, but as you see in this picture, we have seen two small pustular rush. Here I will show you the erythematous area of the nose with red circle and pustular rush with green circles. There are two pustular rush that you see. They are the signs of dangerous staphylococcus infection on the ischemic area. If you see such eruptions with pustular nodules, you should start the antibiotic therapy with full dose parenteral or oral route. But you should consult with infectious disease specialists because you may need to get the specimen and then culture for antibiogram and finding the best antibiotic for treating this, because selecting the best type of antibiotic at this moment is very important and critical. Any delay in finding the suitable antibiotic and prescribing the best one will lead to very terrible result that may end to nasal necrosis that will be very anxious for the patient. So I will show you the final picture of a bad treated ischemic nose. As you see in this picture, ischemic on the nose was spreading, and then you see mottling area of the skin. What's the mottling area of the skin? Mottling is the whitish and pinkish color of the skin, like clouds that you see here. For example, it's not a homogeneous pink or homogeneous white skin. You see some bubbles around them. You see pinker, and in the middle you see white area. This is called mottling of the skin. Mottling shows you that the skin cells do not get enough oxygen because of the obstruction of the arteries, and they are going to die. you should try to remove the obstruction and then provide suitable amount of the blood to the nasal area. Unfortunately, nasal tip area is very, very sensitive to the lack of the oxygen. In other words, here the amount of the arterioles are very low and blood supply, especially in the tip of the nose, is very low. And any ischemic event may give rise to very bad clinical outcome. And you see that here 50% of the skin is going to be necrosed and it needs to be treated maybe by debridement and interference of a plastic surgeon. In other words, the thrombose that was made by a injected filler in the nasolabial area moved toward the nasal area and obstructed some branches here. And this was the end result of obstruction. So if we start the treatment plan promptly and consult with expert doctors in the field of wound healing procedures, you may use the best antibiotics and other procedures that is needed for rehabilitation of the necrosing cell. And if you do your job perfectly, nasal area may be healed, but it may be with some scars. This was the final result of a process that was started through occlusion of a facial artery in the nasolabial area and then ended to the occlusion of the nasal tip arterioles, necrosis, and healing of the wound at the final step. In some steps, the patient may do not have any chance to have a good healing process. In other words, there may be a very bad necrosis and a deep necrosis, as you see here. And then this one. As you see, there is a very bad hole toward the inner part of the right nasal wall. So this may happen, and the only important thing that I need to talk about it is that you should be careful for the early signs of any pain or any occlusion or any discoloration of the skin that I talked about them in my books. And if you are a clinician or a doctor or a registered nurse that you want to inject fillers or working in the daily basis, please pay attention to my academic remarks that I will talk about them in my serial videos in my channel. All of these experiences have been gathered through 20 years of research and with the aid of my co-workers that referred me these patients, but we were able to treat them in most situations. If you have any questions about the complications of the filler injection in all of the face and need some more descriptions about the pathophysiological process, you can ask as a comment, or you can send me your question to my email address listed below. I am Dr. Ibrahim Moghimi. I am so honored to inform you that my future case will be about the occlusion of an artery and ischemic event in globular lesion. Thank you very much. Good luck.